My name is David Chang, and I specialize in cataract surgery and IOL and complications. I practice in Silicon Valley in Northern California in the United States. Well, just this morning we had a session on IOL complications, and of course one of the ones we talked about was toric IOLs and misalignment. Toric IOLs are what everyone really should be doing. It is a premium IOL, but this is just a monofocal that reduces astigmatism. There is no downside whatsoever to it, but probably the number one complication or concern is misalignment. One of the big areas of improvement, I think, has been in digital alignment systems. There's one from Zeiss Callisto, Alcon has the Varion. An important study that was in the September 2017 issue of Ophthalmology from Inouye looked at the net mean rotation or misalignment of a toric IOL at 1 year. And they were able to show that about 28% of that was actually from surgical misalignment. It had nothing to do with rotational stability of the lens. And so that's clearly an area where I think this digital alignment will help us to do better. And there have been studies in the last year that, at least on the Callisto system, showed that the outcomes were actually better with digital alignment versus the typical ink marking manually. We also presented a paper at this meeting, my partner and I, Brian Lee, and we did, during an 18-month period, 1,273 consecutive toric IOLs that we reported on, and about half were with the Acrosoft monofocal platform, about half with the Tecnis monofocal platform. What was unique about our study is this is really the first head-to-head comparison using the same surgical setup, the same method of measurement, and it was also the first time a toric rotational stability study has been done using digital alignment. So this is important because that allows us to really infer that what we are measuring is rotation post-op as opposed to misalignment and or rotation. What did it show? Statistically, the Alcon platform, the Acrosoft, was more stable. And this was statistically significant whether you look at 5 degrees or less, 10 degrees, 15 degrees or less of rotation. And if you look at the percentage of eyes that would rotate more than 10 degrees, it was about 3 times higher with the Tecnis, all statistically significant. If we look at 5 degrees, which is really hitting the target exactly, we had about 92% of the Acrosoft torics were within 5 degrees. Only 82% of the Tecnis torics were within 5 degrees, so quite a bit of a difference. So I think overall we're doing well with toric lenses. Digital alignment will help us, but even then, 92% we get within 5 degrees. So that highlights sort of one of the themes that we heard at some of the other symposia in terms of new technology. I think there was a lot of excitement about adjustable lenses. Adjustability, there are many different things that you can do with that to improve accuracy and so forth. But in the area of astigmatism correction, I think what's nice about that is this can be done post-operatively. The patient doesn't need to have an explanation, an understanding of astigmatism and toricity. We can just show them this is correcting her astigmatism and this is not, and letting them then decide whether they want that adjustment. But more importantly, imagine now that you know exactly the spherical adjustment that needs to be done. You know exactly the toric adjustment, and you're doing it on an IOL that can no longer rotate. So there should be no issue now of post-operative rotation. So I think that is really what will take us much closer to 100% in terms of precision of the alignment and therefore outcomes.